All right, so hopefully everybody can see that. If you can't, please let me know in the chat so I can try to troubleshoot. Okay. So I will definitely explain to you what a mindfulness practice is, why it's good for us, and how you can get started on one in a very non-intimidating way. Because I think sometimes when we hear the word mindfulness, with it being kind of like a buzzword with pop psychology and a lot of therapists taking note of the benefits, it's kind of hard to really sift through all the information and know exactly what a mindfulness practice is and how you can start one. So I'll definitely go over the basics today. And feel free to pop any comments or questions in the chat. And I will hopefully be able to navigate it well enough to where I can answer those questions and share your comments with the group. So we're going to talk about mindfulness practice in regards to combating caregiver stress or caregiver stress syndrome. If you've been in the caregiving world for a while, you've probably heard of the words caregiver stress syndrome. I'm sure you've definitely experienced caregiver stress. And so this is probably not a new concept for you, but I'm going to go ahead and go through just what caregiver stress syndrome is and how mindfulness can help. Good morning, Vanessa.
Good morning.
So we're just getting started, so you haven't missed anything, just my pre-rambling. So we're just getting into it now.
All right.
So what is caregiver stress syndrome? So we all experience stress, and as caregivers, you experience caregiver stress. But caregiver stress syndrome is actually a condition, and it's a condition of chronic stress. So stress over a long period of time, and how it kind of, I don't want to say wreaks havoc, but it can definitely wreak havoc physically, emotionally, mentally. So caregiver stress syndrome is a condition characterized by physical, mental, and emotional exhaustion. Typically, it results from a person neglecting their own physical and emotional health because they're so focused on caring for a chronically ill, injured, or disabled loved one. Sound familiar? Caregiver stress syndrome is strongly associated with negative health outcomes. So I was actually shocked to hear some of these statistics, and maybe it's not news to you, maybe it's a recap, but for me, I didn't realize how deep that runs, how deep the symptoms run. So between 40 and 70% of caregivers suffer from depression, while many caregivers also have anxiety as a result of the stress associated with providing care. Anger and irritability are also common symptoms of caregiver stress syndrome. We did talk about anger and resentment earlier this month. And if you missed that, well, I think we might post it on the website at some point. So if you did miss it, if not, I'm definitely planning on repeating that. So if that's something you struggle with, I got you. I'll get you some tips on that. Chronic stress may also lead to high blood pressure, diabetes, and a compromised immune system. So combating stress as a caregiver is definitely good for your care recipient as well as yourself. So what are some symptoms? So this is kind of a way that you can do a self-evaluation, kind of see if you're kind of creeping out of everyday stress into chronic stress. You might recognize some of these symptoms. Changes in your appetite, weight, or both. So changes in appetite could be you eat more than you need to eat as far as nourishing your body, or you might lose your appetite. Some people are stress eaters, some people are stress starvers. So changes in your appetite from what you normally would consider routine for yourself. You could gain weight, lose weight, feeling blue, hopeless, irritable, or helpless. I really want to focus on that word hopeless. My past job was a suicide prevention educator, and the feeling of hopelessness was the #1 symptom of depression that people reported. So if you're getting into a space where you're having a hard time seeing the silver lining, you're having a hard time seeing anything positive in your situation, and you feel like it's never going to change, it's always going to be this way, that's what hopelessness is like. So if you feel that in yourself, definitely take notice of that feeling. Don't stuff it to the side or act like it's not a big deal. Feeling hopeless is definitely a big symptom of caregiver stress or caregiver stress syndrome. Next, withdrawing from friends and family. I know that that's just kind of the name of the game when you're caregiving. You might not want to withdraw from friends and family, but maybe you just don't have time to invest in those relationships, and that's completely normal. What we're looking at as a symptom here is where your desire to be around friends and family is not the same that it used to be. You're more inclined to isolate because you're just so stressed out. You just don't have any more juice left for any relationship, any type of investment in that way. And so that's when it's the sign of caregiver stress syndrome. Changes in your sleeping patterns. Are you sleeping more than you need to sleep? Are you having a difficult time falling asleep and staying asleep, or experiencing insomnia? Now, we all go through periods of insomnia, and we do, if we haven't had a lot of sleep in a while, maybe we, crash for 10, 12 hours. And that's normal. But we're looking at is a consistent change from what is normal for you, okay? So some people only need 5 to 6 hours of sleep a night and they're fine. Some people, they would like to get more than that, but they just can't, okay? So that's when it's a stress-induced symptom. It's not just a change in your natural pattern. Getting sick more often, that could be an indication that your immune system is starting to kind of weaken a little bit. A lot of times when we're stressed, our body has a hard time keeping up, and we'll start to just kind of break down a little bit. Feelings of wanting to hurt yourself or the person for whom you're caring. This is extremely common. I don't want anyone to feel shame or guilt if this is where you are. This is a normal reaction to chronic stress. Again, if you are in that space, please reach out. There is definitely a lot of resources available, myself included. And at the end of this presentation, I'll give you a few more. Loss of interest in activities you previously enjoyed. Again, it's not that you don't have the time to do these things. You have lost the desire, okay? You're wanting to kind of become a recluse almost. You're not feeling the joy that you used to feel and things that you were enjoying before. And lastly, emotional and physical exhaustion and irritability. Maybe physically you're feeling okay, but emotionally you're completely tapped out, right? Your reserves have been spent. And then the other way too, maybe you are emotionally, you're well of, emotional resources, but physically you're having a hard time staying awake, moving, maybe your body aches, your muscles ache. These are all symptoms of caregiver stress syndrome. So if you're experiencing these things in a chronic capacity, of course, we all have days where we're maybe not feeling the greatest, but the next day we're doing okay. But if it's a consistent pattern that you notice that maybe you're slipping into these spaces that you're not usually in, it may be time to evaluate, am I experiencing caregiver stress syndrome? Do I need to find resources to help? Okay. Any questions on that so far before I move on? You can put them in the chat or unmute. All right, I'll go ahead and keep going. So here are some statistics. And I put these in here not to scare anybody, but I think when we realize what a potential outcome of our ill-managed stress can be, it gives us that motivation to start taking inventory and start looking at how we can alleviate some of that stress. So 11% of caregivers state that their role has caused their physical health to decline. 45% of caregivers report chronic conditions, including heart attacks, heart disease, cancer, diabetes, and arthritis. So it's almost half. Caregivers have a 23% higher level of the stress hormones and 15% lower level of antibody responses than non-caregivers. So that right there is telling you that your cortisol levels are up, your stress levels are up, the stress hormones, excuse me, and then that causes a decrease in your antibody responses. So if you catch a little bit of a bug in your system, your body's not going to be responding to it in the way that a non-caregiver's body would because of the increased stress hormones. 10% of primary caregivers report that they're under physical stress from the demands of assisting their loved one physically. I know some of you are caring for adult children, some of you are caring for spouses that may just be larger than you. And so it's very difficult to consistently be, transporting them, moving them, keeping them adjusted so they're healthy and clean and comfortable. 10% of primary caregivers report that physical stress is something they're concerned about. And I thought this was incredibly interesting and alarming. So if you are a female caregiver, please take note. If you spend 9 or more hours a week caring for a spouse, it increased your risk of heart disease by 100%. Isn't that crazy to think? 100%. 72% of caregivers report they had not gone to the doctor as often as they should have. Which is completely understandable, right? Some of you may be spending all kinds of time in the doctor's office for your loved one, and maybe just the thought of going back in one more time for yourself is just exhausting. You know, you don't want to have to put that on your plate, and so you neglect your own checkups and your own health care because you're just so burnt out. 58% of caregivers state that their eating habits are worse than before they assumed this role. And that could be, again, stress eating. Maybe you're coping with carbs and no judgment. I think it's a great coping mechanism. But if all you're doing is, eating the quick grab and goes, maybe I kind of joke, you're just kind of running past the refrigerator and grabbing a handful of shredded cheese on your way out the kitchen. You're not preparing your meals for yourself in the way that maybe you're preparing them for your loved one. And so you're kind of getting the scraps. And that's a very common thing. Sometimes you just don't have the time to put, the salad on the plate or to prepare the protein for yourself. And then lastly, caregivers between the age of 66 and 96 have a 63% higher mortality rate than non-caregivers of the same age. So what does this all say in the nutshell? Bottom line, stress kills. Okay, stress can definitely create problems physically for you that are going to be harmful later on down the road. So we'll switch now into mindfulness. So this mindfulness is a simple practice that you can incorporate into your daily living that can help you combat some of these physiological and emotional symptoms of extreme caregiver stress. So mindfulness, practicing mindfulness positively affects the brain areas related to perception. So how you see the world, how you see your situation, body awareness. Okay, so maybe, you're more aware of where your stress is kind of hanging out in your body. Is it in your back? Is it in your jaw? Is it giving you migraines? Is there tension in your back? Mindfulness helps you be aware, where is the stress hiding in my body? It positively affects your pain tolerance. So maybe things don't hurt as much as they used to when you get involved in a mindfulness practice. Emotional regulation, introspection, complex thinking, and sense of self. According to neuroscience research, mindfulness practice dampens the activity in our amygdala, which is the little part in the brain that seems to always be angry. And it increases the connections between the amygdala and the prefrontal cortex. So what that means basically, it connects our reactive part of our brain to our rational part of the brain, so that when we have those stressors come at us, we're going to be less reactive. We're going to be able to stop and pause and think, how can I rationally respond to this? How am I going to respond rather than react? Okay. And so it helps us also to recover better from stress when we experience it. Now, I do want to let you know, this is not a quick fix. This is not something that, well, I meditated one morning and now I shouldn't have these feelings. Okay. It is a practice, just like going to the gym, working out, eating healthy, any positive shift that you make in your lifestyle. It's going to take time before you see those results. And mindfulness is no different. So what is mindfulness? Well, let's talk about what it's not, okay? Mindfulness is not a religious or spiritual practice. There are many world religions and spiritual practices that involve mindfulness, but mindfulness in and of itself is completely secular. It is not, you don't have to be a yogi in the mountains somewhere. You don't have to look for transcendentalism or enlightenment through these practices. It's really just neurologically a way for you to strengthen your resolve and to strengthen your ability to combat stress. It's not checking off or creating a mental to-do list. Sometimes when we sit in silence, we think, well, now's the time for me to run through my Rolodex of the things I need to do. That's not what mindfulness is. It's also not replaying scenarios of guilt and shame. Sometimes when we get in that quiet space, here comes our saboteur, right? Our inner saboteur telling us of all the things we should have done and all the things we didn't do right. That's not what mindfulness is. And it's not about having a completely blank mind. That is physically impossible. I mean, maybe if you've been, studying in the Tibetan mountains for decades, possibly, but no one I know has ever been to that place where they have been able to willfully become brain dead through mindfulness. And again, it's not a quick fix. Like I said before, this is a practice. So it takes a little bit of time to feel the benefits of it. Mindfulness is engaging your senses. So what do you smell? What do you taste? What do you hear? What do you feel? Being fully present in the moment. So that means that you're not thinking about what you used to do or what you have done, and you're not thinking about what you need to do or what you should do. You're really in that present moment. I'll explain to you why that's important. Mindfulness is observing yourself without judgment. Easier said than done, right? But mindfulness is about just experiencing the moment, experiencing the emotion in the moment, and not judging yourself for how you feel, whether it's angry, jealous, frustrated, sad. Okay, these are all appropriate responses. Do not shame yourself from these feelings. We can observe them and respond without judgment. And it's an opportunity to give your nervous system a rest. And this is really what I think mindfulness boils down to. So I'll give you an illustration. I know most of us, or some of us at least, have had the experience of holding, maybe a 1 or 2 year old child. And if not, you can probably imagine they're, anywhere between 30 and 50 pounds at this point, or maybe less than that, I can't remember. But it's kind of like a couple sacks of potatoes. And if you're holding that baby on your hip, after a while, your arm starts to get a little sore, right? And you start to feel a little ache in your shoulder, maybe your hips feeling a little sweaty. So what do? You shift arms, right? You give that one arm a rest. I view mindfulness in the same way, that mindfulness is a way to give your brain something else to focus on besides your tasks, besides your caregiving role, okay? You are just allowing your cerebral part of your brain to kind of relax while you allow the sensations of your body and of your environment to come to the foreground. And so what that does for our brains neurologically is it's, you're walking around with this, tension, this clenched mindset. If you think about like squeezing your fists together really tight, and mindfulness allows you to relax that tension by switching the focus on physical sensations rather than mental intrusions. Does that make sense to everybody? Does anybody have any questions about that before I move on? Okay. So here's some good ideas to get you started on maybe doing a mindfulness practice if you've never heard of it or you've never tried it before and you're a little intimidated. So just remember, mindfulness is a gentle effort to be aware moment to moment. You can train your brain to be more mindful or more aware of your sensations. It's just like strengthening a muscle. So here's some try these following exercises to become more mindful. So most of these are not going to be simple to do. I mean, they are simple to do, but it's difficult to break mental patterns sometimes. So letting go of the past and future thoughts. So if you let your mind wander in the past, you may waste your energy on regrets. If you think too much about the future, worries can drain your energy. I'm sure many of us have had that experience. Of course, brief trips to the past and future are needed to deal with practical matters, but the power lies in the present moment. Okay, so remember what I was saying before, mindfulness isn't about just sitting in the silence and berating yourself of all the things that you wish you would have done differently and all the things that you're hoping to do in the future. You're really trying to allow those thoughts to kind of float past you. A lot of people who practice this will say, imagine that you're staring at a cloudy sky and your thoughts are just the clouds passing by, where you can acknowledge that they're there, right? Acknowledge I'm upset, acknowledge that I'm stressed, acknowledge that I'm frustrated, but then you just let it pass over. You let it fly across the sky, okay? You don't have to pluck it out of the sky and hold on hold on tightly. So that's kind of a nice illustration of visualization. If you're having a hard time staying in the present moment, don't try to push the thoughts away. Just let them come up and then release them, okay, without judgment. Accepting the present moment without judgment, accept it as it is so that you can use your energy to directly handle the circumstance at hand. So mindfulness frees you from the tendency to react. I'm sure we've all had those moments where, everything that could go wrong in the day does go wrong. Maybe you woke up late, or, you missed your bus, or, you didn't get your kid out the door in time, or, your loved one needs, extra steps in their care that morning. Things aren't going well for them either. And you're handling it okay, but then one thing happens after that and you just explode. For me, it's, stepping on a wet floor in socks. For some reason, that always happens when I'm stressed out, and like the one more thing can't go wrong, and then I'll step in water with a sock on, and it's just like, oh, that's the worst thing that could have ever happened to me today. But mindfulness practice, again, it kind of slows that reaction response where you can stop, accept the moment, accept that you stepped in that water in your sock, and it's okay. It's not the end of the world. Okay. Meditate. So meditation, I think, is probably one of the most intimidating practices when it comes to mindfulness practice, because it is very difficult for us, especially in this day and age where we are bombarded with information and stimulation 24/7, to sit in a space where, you're just still. You're still physically, you're still mentally. So that's why breathing exercises are really helpful when you do start a meditation practice, because your breathing is constant. It's always there, right? So focusing on your breathing, just by breathing deep into your belly and following your breath all the way in and out, just really focus on the sensation of the air going into your nose, down your throat, and into your lungs, and feeling that body, rise and fall with your breath. It seems incredibly simple, and you might feel kind of goofy doing it, but it really does help get your mind on track of that stillness, to where you're not rummaging through the past and you're not projecting out into the future. So if you try it for 3 minutes, 3 times a day, it actually does help transform your brain and give it that rest that it needs. It doesn't have to be complex. It doesn't have to be complicated. It just has to be consistent. Number 4, get in touch with your senses. Notice the sounds around you, the temperature of your skin, the scents in the air. Slow down and notice what's going on around you in the moment. Now, this might seem kind of silly, because you're like, well, of course I'm noticing sounds around me. Of course I know when, I'm cold, or, when something smells funny in the air. But mindfulness in this regard is very intentional. So you might know that your body is, accepting that information and processing that information, but so much of that happens subconsciously or happens in the background. Mindfulness encourages you, or invites you, I should say, to just really explore the sensations when they come up. So one example I gave in a previous class was, if you're drinking a cup of coffee, really sit and feel, how does that sensation, how is that warmth in your hand? What is that smell in your nose? What is that taste on your tongue? And just slowing down and taking that in consciously, intentionally, your brain loves that. That is what releasing that tension in your brain, giving it a break is all about, because you're telling your brain, we're not going to stress out about all the things buzzing around in my mind right now. We're going to focus on my sensation, my 5 senses, my body feelings. And it kicks your brain out of cerebral mode into body mode. And that's what gives your brain that break. Practicing mindfulness during routine activities. I just gave you a good example. So be mindful in the moments, as like brushing your teeth or taking a shower. That's one of my favorite. I love to get, in the shower at the end of the day and just feel the warm water on my face and in my hair, and just really take that moment to just enjoy that, luxury, really, if you think about it, of having warm water on tap to just be able to relax into. Be mindful when you're eating or walking. For example, you can feel the ground against your feet while walking down the street, take in small details. There's actually something called a walking meditation practice, where with every step, you're just very mindful of, how your joints are moving, how the muscles are engaging, feeling the earth beneath your feet, and really ground yourself in that. It seems incredibly trivial, maybe, incredibly simple, but your brain is going to love you for this. I promise you, after a while, you're going to be like, I need to go meditate. I need to go be mindful, because my brain is clenched really tight right now. So mindfulness trains your brain to be more efficient, focused, and less distracted. It's also been shown to lower blood pressure, to improve your memory, to lessen depression and anxiety, and is associated with increased athletic performance. So if any of you guys are looking to join the Olympics, mindfulness might help you in your training. Just being silly, but it really does help. It seems, okay, well, she told me to think about the strawberry when I eat it, whatever. No, it really does help. Your brain will really eat that up. So if you are experiencing some of the symptoms I talked about earlier, chronically, and you're feeling maybe that hopeless feeling, or you're feeling really burnt out, you're feeling like you don't have the energy to enjoy the things you want to enjoy anymore, please reach out for support. And here are just a few options that you can take advantage of. So I do host a monthly support group. The next one is July 21st, so just a few days away at 10 a.m. It's just an opportunity to be social with people on a similar journey as yourself. This month, we're going to do trivia through the decades. So if you want to come and show off, I really encourage you to register. We do weekly caregiver education, just like this. So I'm sure obviously you guys know we do it because you signed up, but if you don't know that we do it every week with different topics, now you know. And also the Caregiver Wellness Initiative. So for those of you who don't know what this is an opportunity for you to possibly get some professional medical therapy, or licensed therapeutic help. If you are on our program as a respite recipient, then you can qualify for the Wellness Initiative. And so what that means is that you can choose a therapist or a counselor that's licensed in the state of Alabama that accepts direct payment, and we will give you a stipend for up to 3 sessions. We just deal with the payment part of it. We don't get any details of your sessions. We don't, query about, your progress in any way, shape, or form. It's between you and your therapist. We just pay the bill. And if you go through those 3 sessions and you and your provider think that you might need a little bit more, we can extend that to 3 more sessions. So those are just a few options we have to support you. And I hope that you take advantage of them. And I really hope that you get some information that's helpful to you. Again, a last resource is me. I am the Caregiver Outreach Specialist. I'm also a social worker, and my background is in crisis counseling and suicide prevention. So if you have any of these feelings that maybe you're not comfortable talking with somebody else about, or maybe you don't feel like you're ready for licensed therapy, give me a call. I'm here Monday, Tuesday, Thursday, and Friday from 8 a.m. to 4:30. You can also email me at jstang@ucphuntsville.org, and I will be a non-judgmental active listener for you if you just need to release that steam a little bit. Okay, so that's the end of my presentation. Does anybody have any comments or insights or questions? I would love to hear some feedback if anyone has any to share.
Good morning, Jeannie. This is Shirley. Thank you so much for the information. Can you send us your notes? Can you share those?
Oh yeah, would you just like me to send you the PowerPoint?
Yes, that would be great.
Yes, because my notes are scattered and you probably can't read my handwriting, so I'll send you the typed version.
You share some things that, of course, we don't always think about. I don't. So I appreciate that. And I didn't get a chance to write them down. So I appreciate it.
Yes, I can email that to you, Shirley. And if anybody else wants the PowerPoint, just make a little note in the chat and I can send that to you as well. I'm glad you got something out of it, Shirley. That makes me feel good in my soul.
Oh, most definitely. In fact, well, this is one of those mornings. Okay.
Yeah. Did you get a wet sock kind of a morning?
Well, I'm trying to get her into physical therapy now. So yeah, I need to do that.
Yeah. And, it's one of those things that, at least for me personally, I've heard about mindfulness off and on for years, and I never thought it was worth trying because I thought, well, that just sounds really stupid. Like, why would I focus deeply on my ham sandwich? Like, I'm just going to eat it and go. But it really does help the brain to have that release. You're not like this the whole time in your brain. You can release a little bit, and it has affected my reactivity in a lot of ways.
Okay.
Positively.
Okay. So are you in the office the rest of the day?
I am, yes, I am here until 4:30.
Okay. Once I get her situated, I might give you a buzz, because especially they're talking about, when you were talking about the psychiatrists that's available. I know that when I had talked to you once before, there wasn't any one in the Birmingham area. So
Okay.
perhaps I can do something online.
Yes, and the Caregiver Wellness Initiative does expand out to telehealth providers. So
Okay.
if there isn't anyone that you want to see, or no one that's available in your area, maybe you can find someone out of area and just do the telehealth through the internet. Yeah.
That would help. I mean, just talking to people that understand what we're going through. I mean, that I'm not crazy.
Yes, yes. Validation goes a long way in us healing and being able to cope, definitely.
Yeah. Okay. Thank you.
You're welcome, Shirley. Any other comments or questions or insights?
This is Charlotte.
Hello, Charlotte.
I was asking, hi, I was wanting to know, you mentioned the caregiver support group date.
Yes.
Was it a support group for the caregivers?
Yes, ma'am. We do it on Zoom. So if you're interested, you can go on our website at alabamarespite.org. Click on the little tab that says Caregiver Events. And if you scroll to Break, BREAK, I'll go ahead and put it in the chat, support group. You can register there.
Yeah. Okay, so is that in-house or is that online?
That is online. So it'll be just like it is today, except we'll be playing trivia.
Okay. All right. Thank you.
You're welcome. I'll go ahead and put that in the chat there. So it'll be this Friday. And if you can't make this Friday, that's okay. We have one every month. And so if you just check our website, you can register there. And then the day before, I'll send a Zoom link out to you so you can join us. And again, they're all free services. So. Anybody else? I don't want to cut too early if anyone has anything that you need to talk about or want to make a comment. Okay, Patsy, I will definitely send you that PowerPoint. And again, if you have not put your email in the chat, please do so before we end, so I can make sure to send you a post survey so that we know if we're serving you well, if you found this information useful. And I welcome any and all comments or suggestions on topics. So you can email me at jstang@ucphuntsville.org and tell me what you want. Give me some feedback so that I can make sure that I'm giving you information that is valid and helpful to you. All right, well, I will definitely I encourage everyone to develop their own version of this mindfulness practice. There's really no right or wrong way to do it. You know, every person's individual, every situation is individual, and you know, you might not be able to have a meditation room and sit on the mat for 3 hours. Nobody's asking you to do that. And that's okay. You just do what you can when you can. And if it helps you, you'll be encouraged to do it more. And if you find it's not really helpful, well, then you didn't waste any time doing it, right? All right, well, I hope all of you have a wonderful rest of your week. I hope to see all of you on Friday with their caregiver support group. Again, feel free to reach out, even if it's just a chat. I'll be here. All right. Have a good day, everybody.